Good afternoon, everybody. I'm Mike Quinones. I guess I can say today that I'm one of the senior cardiologists at Houston Methodist since I have been here for 40 years. I would say that my daughters were very little when I started working here. I'd like to welcome you to this second afternoon session of The Heart of a Woman. I'm really delighted that you all are here. I personally do a fair amount of talks to lay public about heart and prevention, and I would say 70% of the time, the public that I talk to are women for many good reasons. And in my opening slides, I usually have a couple of slogans. One is, knowledge is power. And the second one is, what you don't know could kill you or kill one of your loved ones. So I really hope that this afternoon you are becoming more powerful because you're gaining a lot of knowledge, and that you'll be able to use this knowledge not only for yourself, but also for your loved ones, your friends, and so on. And the timing is perfect because, as you already know, hopefully all of you received a copy of our journal. We have the DeBakey Cardiovascular Journal, which we have been publishing for about 10 years. Dr. William Winters was the initial editor-in-chief, and I had the privilege of taking over for him a year ago. And this is a journal that is designed, of course, for medical people. But actually, there's things here that you can read because it's not so difficult to read. It's published quarterly, and each issue has a topic. So each issue is dedicated to a particular topic in cardiovascular medicine in the form of reviews. So the purpose of the journal is to educate physicians in practice. This goes to about 35,000 cardiovascular physicians across the country, to educate them and keep them up to date as in a review format. So as they read the articles, they're basically getting a review of what's new in a particular topic. It turns out that the current issue of the journal, as you can see, is Women and Heart Disease. And the guest editor was our esteemed Dr. Kurrelmeyer, who is one of the co-directors of the course. So the journal is mailed in a printed version to about 35,000 cardiovascular specialists in the country. And I can tell you, you will not be in the mailing list. However, you don't have to, because you can go to our website. So if you go to journal.houstonmethodist.org, that will bring you to our website, and you can do that as many times as you want to. And the website basically contains the issue, the current issue of the journal, but in addition, a lot of other goodies. So it has a section on humanities, it has some poetry, it has some sections on health sciences, the state of healthcare in the US, and it has some cases for physicians to see. And I wanted to point out to you that in this current issue, our esteemed assistant editor of the journal, Laura Jerick, put together this piece, which is called, Where Are Women Cardiologists? And this is also a very important topic for all of us, very dear to our heart. So I'm just going to show you a couple of things. I'm sure that this topic will come back probably at the end in the panel discussion. But half of medical graduates are women. That's good. One of my daughters is in that. Yeah. She's been practicing for 15 years now. Half of internal medicine trainees are women. You're not surprised if you go to try to find a primary care doctor today, chances are it will be a woman. In fact, in our own primary care network, I would say we probably have about 70% women and only about 30% men. So those are all good news. But here comes the one that is not so good. Only about 10% of all cardiologists are women. And about 20% of current trainees in cardiology are women. So that's good, right? We're going from a pool of 10% to now 20% training, so hopefully over the years, the 10% will go up. But still, when you think of 20% of trainees being women today versus half of trainees in internal medicine being women, there's a big disparity. So we're trying to work on this. The American College of Cardiology is very active. And in fact, if you read that piece, you'll learn more about the things that the college is doing to try to improve those statistics. My plea to you is, if you have daughters, nieces, friends, young friends who are going into medicine, start getting them encouraged into cardiology. It's actually a fun specialty, one that you don't have to be scared of. As Dr. Kurrelmeyer can tell you, she is a wonderful cardiologist. She's a mother of two and a wife. So really, it's one of the things that we are trying to improve, and you can do your part just by sharing it with your relatives and friends.